Closure of abdomen is fruitful when Jenkins rule is followed. First, cover the abdominal cavity by placing a sterile pack. Now hold the linea Alba with Alice forceps and pass needle inside to outside, then from outside to inside at right angle. Now open the Alice forceps and tie the knot. Put minimum of 6 knots, as the first knot is the basic strength of the sheath. In adults, non-absorbable monofilament suture is used. Most of the time we use prolene one, but nylon can also be used. Now apply 2 Alice forceps, one on each side of the linea alba, and lift them while passing needle through the sheath. Keep the needle 5 mm from the edges and also from one stitch to another stitch. While passing the needle through the linea alba, ask the assistant to detect skin with every successive turn. It will help to easily close the sheath without the interruption of the skin. Always hold the sheath with Alice forceps while passing from the edges, and also retract at the right angle to the wound. According to the Jenkins rule, the length of the suture should be 4 times the length of the wound. So always measure 4 times the length of suture according to the length of the wound. This will prevent the wound dehiscence and burst abdomen after the closure of abdomen postoperatively. Always grasp the needle from medial to third from the on the body shank, so that it will pass smoothly at right angle to the edge of the linea alba. While passing needle, always take care of the intra-abdominal structures, particularly the gut and the omentum, so that it will not get adherent to the overlying suture. Also be careful to take the fibers of sheath, not include the fibers of muscle, because when the muscle get sutured, it will lead postoperatively dehiscence of the wound due to the lysis of muscle fibers. As burst abdomen occur most of the time from 4 to 6 days, it will lead to the lysis of muscle fibers that ultimately shows serous discharge at the dressing. So I always recommend you to include only rectus sheath, not to include rectus muscle. We have closed the one side. Now proceed from the lower side of the wound. Similarly, we proceed from inside to outside, then outside to inside to get the knot into the abdominal cavity. It will prevent any stitch sinus postoperatively. Hold the sheath with Alice forceps and then pass needle from the edge 5 mm apart from the edge, and also when with each successive turn pass 5 mm away from the neighbor stitch. You can appreciate that my assistant is doing well. It is retracting skin with a plain forceps on each successive turn from side to side of the wound. Where you feel that the sheath is strengthened and the needle is not easy to pass, always take care and change the position of the needle so that it will pass easily and it not get hurt your finger or hand. A surgeon always take care of the instruments. It also includes the care of the assistant staff. Do not try to close each stitch with full strength, because at the end we have to find the way where we can insert the figure and check that no portion of gut or omentum has been attached in the stitch to the anterior abdominal wall. Now I have applied the Aberdeen knot and ensured that no part of gut has been taken into the stitch. I have applied almost 6 to 7 knots. Always take care of the needle. Do not get injured your hands. By applying Aberdeen knot, I am assured that the portion of linea alba that I have closed has been successfully taken into the stitch, and further force is not required to close it with each successive turn. You can see I am doing it from going outside to inside, then inside to outside. I'm also assuring that my sponge pack moves outward successively so that I am assured about the successful closure of linea alba without any hindrance created by the pack. I use pack because most of the time we get obstructed by the underlying portion of gut. This pack will keep the intestine inside without any interruption during the stitching of linea alba. Always remember the main strength of the anterior abdominal wall is rectus sheath. Linea alba is formed by the fibers of external oblique muscle, internal oblique muscle, and transverse abdominis muscle. Multiple intersections pass through the rectus abdominis anteriorly and posteriorly, and they meet in the linea alba. Linea alba is a fibrous structure that is whitish in color and is thick. While palpating it, we find it as a cord-like structure. Multiple stitches are applied so that the wound is closed properly. The linea alba must be closed without any defect. Otherwise, where the defect lies, it will lead into the formation of incisional hernia postoperatively because the contents protrude through the defect in the linea alba. Hernia occurs when there is defect in the rectus sheath or the linea alba. Internal hernia can also occur, but most of the time we have to deal with the external hernia. The hernia can become strangulated. First it becomes obstructed, then it becomes strangulated, and later on it leads to the development of gangrene of the tissue. Always remember, remove the sponge or any foreign material that has been put into the abdominal cavity. Otherwise, it will lead to the formation of gossypibioma, also known as textiloma. Most of the time, we have to check it again and again, and always make sure the count of instruments and the sponges that has been used intraoperatively gets checked by the staff, and write it on the board so that postoperatively it should be checked. Never ever close abdomen without checking your counts of the instrument and the number of sponges. It is duty of every person who is involved in the operation. Particularly, the staff is assigned to count every instrument, but it is the duty of surgeon also to make sure that his patient safety should be checked at every step. Always maintain the rules and ethics of your surgical field, including handing off the instruments and also the care of patient intraoperatively, preoperatively, and postoperatively. Now I have checked with my fingers that no contents has been indulged, and now I close the thread 1 and thread 2 and have applied a tight knot. Not too much apply a pressure on the knot so that the fibers get transected by this prolene. Apply a minimum of 6 to 8 knots because prolene is slippery, so its knot gets untied by putting. We have anchored only umbilicus because the wound condition was dirty, so chances of the infection was high. To see any intra-abdominal infection or abscess collection, we made the skin left open and later we will close it by performing a delayed primary closure. Now perform an antibiotic dressing. We use neomycin as a paste on the abdominal skin, and then we place sterile dressing pads to close the skin with a sterile dressing. Always be careful while dressing and perform by your own self under aseptic measures, because any septic measures will lead to the development of infection of the skin. Thank you.